And now we're going to see an interview with Dr. Armand Rodriguez when he discusses anesthesia. Good afternoon. I'm Dr. Carrasco with Doctor to Patients. Today we have Armand Rodriguez, a well-known anesthesiologist here in our city of San Antonio. Dr. Rodriguez, what are we doing today? We have a patient, we're going to replace a pump on him. What plans do you have for this patient today?
My plan is to provide a general anesthetic to this patient. What we'll be doing is injecting him through his IV with some propofol. It's a general anesthetic. And then we will be securing his airway using an LMA, which is a laryngeal mask.
So what is the difference between a general anesthetic and a local anesthetic?
In the general anesthetic, we actually provide a slightly more of an anesthetic. In a local anesthetic, the anesthetic is injected in the area that it's working. This provides a little bit more of an analgesic, less pain at the injection site, and it's a little bit more comfortable for the patient. So
how do you determine what kind of anesthesia do you do for each patient?
That is determined by the level of anesthetic that we're actually going to need for the patient. Some procedures need to have more muscle relaxation and they need to have a larger amount of anesthetic. Some of the ones which are more local can get by with just using a little bit of a sedation technique.
Right. So really you can actually just kind of give them comfortable while the surgeon kind of gets the area numb and do that without putting them to sleep per se.
Exactly.
Or depending on what the patient needs, like you said, if we need to get them paralyzed, then you can do that with some medications that you use, get the patient very comfortable and very sedated and very really unable to remember anything.
Exactly. The anesthetic is actually tailored to the individual patient, their individual medical necessity and the need for whatever needs to be done for the procedure to be performed.
So in today's case, he really doesn't need a lot of anesthesia. He doesn't need to be asleep for a long period of time. It's just a simple little, probably 1 hour procedure.
It's a simple procedure, plus the anesthetic is augmented by the surgeon by injecting local in the area. So therefore, the pain stimulus decreases once the local anesthetic begins to work.
Thank you for your time today. This is a simple case he's going to do today. Simple by the fact that they don't require a lot of risk, doesn't require a lot of deep anesthesia. The patients will essentially be just comfortable and relaxed throughout the procedure. Armand will do a great job, take care of that part of us for us. As we go forward with this section, we'll talk about what he's doing and how he puts his LMA in there and what he has to do to get the patient ready. Thank you. When we come back, we'll go to med school and show you what Dr. Rodriguez and I were talking about.